How would you like to overcome chronic pain? Leigh Brandon will tell us how, and he's a Czech faculty instructor, functional medicine practitioner, and host of the Radical Health Rebel podcast. And since 1996, he's helped people overcome chronic pain and complex health issues by addressing the physical, biochemical, emotional, and energetic roots of their symptoms. And whether it's sports injuries, gut dysfunction, or unresolved pain, he specializes in guiding those who've tried everything else toward true healing and lasting transformation. So, Leigh, tell us, how can entrepreneurs overcome chronic pain? Heal Podcast with Lily Patrascu shares longevity and anti-aging techniques to stay young forever, increase energy, overcome addiction, and live your longest, best life ever. Shared by world's most innovative, alternative, and traditional health thought leaders, healers, and doctors. Discover quantum healing strategies to heal your mind, body, and soul.
Well, it's quite an interesting subject, and it's something that a lot of us suffer with. So in the UK, for instance, 30 to 40% of the adult population are suffering with some form of chronic pain at any one point. Now, the term chronic sometimes gets misunderstood. Chronic just means it's been happening for a period of time. It's persistent pain. Now, depending on what country you're in, depends on how long it is before it's considered chronic. In the UK, it's 6 weeks. So if you've had any pain for longer than 6 weeks, that's considered chronic. So people often ask me, how do I work? And I generally say to people that I work in from four different aspects. One is from a biomechanical aspect or musculoskeletal aspect. So for instance, if you've got poor posture, what that does is that creates excess stress on certain tissues in the body. It could be the joints, it could be the muscles, the tendons, the ligaments, etc. Sitting in a chair all day is one of the worst positions you can possibly be in all day long. It puts a lot of pressure on your discs and your spine, for instance. So one of the ways in which I help people is to realign their body, improve their posture, improve their core stability. And then once I've helped them to do that, to optimize all of those, the next thing is to get them strong enough to be able to do whatever it is they would like to do in life, because even entrepreneurs have fun at times too, play sport, whatever. So it's getting to the point where the tissues of your body can do whatever you want it to do without becoming painful. So the biomechanical point of view is very important. Another aspect that is often not really considered is the foods that we eat. Now, the first thing I'll say is you are what you eat, right? Our bodies are made from the things that we eat. So when food goes into our body, that becomes us, okay? Now, there are certain foods that we know are what we would call inflammatory. So if you think about what is inflammation, most of the time, inflammation is basically our immune system going to work. And our immune system goes to work when there are things in our body that shouldn't be there, okay? So there are particular foods that we know are considered inflammatory. So things like seed oils, particularly if they've been heated, vegetable oils, processed sugars. Most processed foods have one of those or combined aspects of those. Gluten, we know, can be quite inflammatory. Now, there is a debate. Is it the gluten or is it the fact that it's often sprayed with glyphosate, the weed killer? Often used to dry the grains before they're harvested. But oftentimes these things can cause inflammation in the body. And if people don't realize that, they could be going to their doctor with a particular pain issue. Now, the problem is a medical doctor isn't trained in nutrition and they often won't be picking up on these things. So they might give you a drug to use and that will suppress the symptoms. But what it won't do is get to the root cause of the problem. And it could be that things that people are eating are part of the root cause of the problem. So there's two aspects, the biomechanical and the nutritional aspects. The third way in which I work is actually linked to the biomechanical, and that's hands-on therapies. So I originally trained in sports massage. I haven't delivered a sports massage session for 12 years. And the reason I haven't is because I learned another technique called active release techniques. And for want of a better phrase, it's like an advanced form of sports massage. It's done without any oils, without any lotions. It's done skin to skin contact. And for optimizing the function of the body and for helping reduce pain, it is just incredible. Now, I just want to caveat that by saying to people, I still think people should get sports massage. I think it's amazing. Just because I don't do it myself doesn't mean I still don't recommend it for people. But to get some kind of hands-on therapy as regularly as possible, again, is highly, highly recommended. Now, I would say ideally once a week would be good for most people. The fourth aspect, and again, this is one that's probably not so well known, is the energetic aspect. Now, when I say energetics, I'm talking about things that are in our environment that aren't necessarily solid. Now, some people argue that nothing is solid, and according to quantum physics, that's what a quantum physicist will tell you, that nothing in the universe is solid. Even if you look at an atom, 99.9% of an atom is empty space, right? So what do I mean? What do I mean by energy? Well, one of the things that has been found can cause pain on its own is trapped emotions in the body. So if someone goes through and has some kind of emotional trauma, so let's give you an example. Let's say someone's out mountain biking one day, they have a bad accident, they fall on their knee really hurts. But going through their head are things like, oh no, if my knee hurts, I'm not going to be able to go to work, I'm not going to be able to lose, to make money, I might, lose my home, I might not be able to look after my kids. So they've got anxiety and worry. Now that anxiety and worry can get stored in the knee. 10 years later, their knee is completely healed, but there's still pain in the knee, right? And there's not one cell in the body that was there when the accident happened. So why is there still pain in that area, right? So one of the things that I do is called the emotion code. So I can actually find where people have trapped emotions in the body and release them. So in some instances, people have come to me and they've had a session of emotion code. So let's just say they have back pain, and I find some trapped emotions in the body, may or may not even be in the back itself. And they'll call me the next day and they'll say, what did you do to me? And I'll say, why'd you ask? And I say, well, my back pain that I've had for 10 years, I've woken up for the first time and there's no back pain. So it's really important that when we look at pain, quite often what pain is there for is to warn us. It's a warning sign. It's a form of communication from our subconscious mind to our conscious mind. To think of it another way, pain is like the engine warning light on the dashboard of your car. If you have a problem with the engine, the warning light's going to come on. And what's it telling you to do? It's telling you to take your car to a mechanic so they can look at the engine, find out what's wrong with the engine and fix it. Okay. Now, unfortunately, what tends to happen in this analogy is that if you imagine we are cars, an engine warning light comes on, i.e. pain, we go to a professional, and rather than look under the hood and look at the engine and find out what's wrong, they will either give you a piece of black tape to cover up the light on the dashboard, or they'll take the bulb out of the warning light, or they'll cut the electric to the bulb, right? Now, what I'm referring to is pharmaceuticals or surgery, generally, right? So you're either masking the pain or you're just cutting it out, okay? So if you imagine walking along the street and you step on something sharp, let's say it's a nail that's sticking out, your pain signals are going to tell you that your foot has just touched something sharp. Now, if your brain doesn't respond, what's going to happen? Your foot's going to go straight through the nail, right? Or the nail's going to go straight through your foot. So our pain system, if you like, is there as a warning sign. So that would be like an acute situation. But what happens in a chronic situation? What quite often is happening, if you know how to read the body, because again, there's lots of signals within our body. So over my shoulder, if anyone's watching, you'll see there's a image of a lady and what's called the 7 chakras of the body. Okay. Now, again, this is working on the energetic system. Each of the chakras refer to specific aspects. So for instance, the first chakra, what's called the root chakra, refers to safety and security. So sometimes, and again, this isn't all the time, sometimes, let's say someone has a knee injury. I've literally just been consulting with someone that does. It might be that they've got issues around safety and security and it's showing up as knee pain in their body. Okay. So if I'm working with someone and they come to me with knee pain, that is a question that I'm going to ask them. Now, guess what? The person I was just consulting has got money issues. What's a money issue? It's a safety and security issue. Now, whether that's the cause or not, or one of the causes, I still don't know yet. I need to dig deeper. Another example is the neck. So the neck is in the region of what's called the fifth chakra. The fifth chakra relates to communication in the body. Now, I've got a really good story of someone who I saw, I'm trying to think now, 21 years ago. And she came to see me with neck and lower back pain. Now, sometimes if you've got a problem with the neck, it can be replicated, if you like, in the lower back. So the neck and the lower back, they work very closely together. And when she first came to see me, I just asked her the question. I said, how do you get on with your mother? Like, how do you communicate with your mother? So her neck pain was on the left. The left side of the body is considered to have female energy. The right side of your body male energy. So because her neck injury was on the left, again, I was just inquisitive. How do you get on with your mother? How do you communicate with your mother? And she said to me, don't talk to me about my mother. We don't get on. She never loved me. We haven't spoken for years. And I thought, oh, okay, that's interesting. I might be onto something. So anyway, I worked with her for a few days. I did analyze her. I gave her an exercise program. We discussed nutrition. But during that time together, I did teach her a communication skill called nonviolent communication, with the view that she goes back home and she contacts her mother and tries to heal those wounds that she's had since childhood. Anyway, 6 months later, I get a letter from her saying, I can't thank you enough. Not only is my neck and back pain gone, but me and my mother are getting on really well. And in fact, we're loving our time together and we're seeing each other every day. So the way that I look at the human body is it's like a map. And you need to work out, when someone's in chronic pain, where is the pain coming from, right? Because what you need to do, you need to treat it at the root level, rather than what a lot of people do. And understandably, they're in pain. The first thing they think is, I need to get rid of the pain. I need to mask the symptoms. I need to cover up that engine warning light that's on my dashboard, rather than taking it to the mechanic to find out what the root cause of the problem is. So whilst pain can be quite complex, a lot of the things that people can do are actually quite simple. So there are 6 what we call foundation factors, 6 things that I advise everyone to do, whether they're in pain or whether they just want to optimize their health. So number 1 is to have positive thoughts. And we know this is massively important when it comes to pain. Like your mind, your perception, your beliefs have a massive, massive effect on pain. So if you're optimistic, your threshold for pain increases. So you can do more things before you're going to feel pain. If you're pessimistic, if you're depressed, your threshold for pain goes down. So you're going to feel pain much sooner. Okay. We also know that things like visualization techniques can help. Some people call it affirmations. So it's just believing and almost feeling how your body's going to feel when it's not in pain, and just focusing on that consistently. So being positive, having a positive mindset about your pain, and being positive that you will definitely get better, has a massive effect. The second thing is your breathing. So with breathing, if you breathe too quickly, it makes your body into a stressed state. So by slowing down your breathing, and you can do things like meditation, and there are obviously different techniques of what we call breath work, can all massively reduce our stress levels. And again, the more stressed we are, the more pain we're going to perceive. Okay? So we've got our positive thoughts, we've got breathing. The other thing with breathing is, when we're stressed, the way that people tend to breathe is they breathe into their chest and their shoulders. Okay? The ideal way to breathe at rest is into your tummy. Now, a lot of people don't like breathing into their tummy because it makes their waistband expand. So a lot of people like sucking in their tummy, right? But breathing into your tummy, because what that's doing is it's using your diaphragm, which is the primary muscle for breathing in the body. So breathe slowly, breathe deeply, and breathe into your tummy. That will help reduce your stress. So positive thoughts and slow, deep breathing. The next thing is hydration. So hydration is really important purely because our body is 70% water. If we don't have enough water in the body, nothing in the body can work effectively. Okay. And again, another thing that can increase the perception of pain in the body is toxins. And we know that the best solution to pollution is dilution. So being hydrated is really, really important. Now, when it comes to hydration, it doesn't mean any old water will do. Okay, there you go. So I don't advise people drink tap water in most countries because it does contain a lot of contaminants. Ideally, if you can get water from an artesian well and it's been tested and it's safe to drink, it's probably ideal. If, like me, you don't live anywhere near one, then what I'll tend to do is I put my water through a filter. So I use a reverse osmosis filtration system. One of the filters remineralizes the water because you don't want to drink pure reverse osmosis filtered water because it's quite acidic. And obviously there's no minerals in it. You can go a step further if you like, and you can also what's called restructuring of your water, but that's a whole nother podcast episode. There are also people that promote hydrogen water. Again, I don't know enough to talk about that, but a lot of people really, really believe in hydrogen water. The next thing is your diet. So again, I've kind of talked about diet a little bit already, but some of the key things about your diet is to try and eat as natural as possible. So try and avoid processed foods, packaged foods, foods that's come from a factory. If you for instance, if you buy an apple, or even better, grow your own, it hasn't gone through a factory. Try to eat as much produce from organic sources as possible, unless it's fish, in which case I'd suggest wild. And also be aware of your own genetic background, because that also plays a big role in what's the right kind of foods for you. So I imagine, Lily, your name sounds kind of Romanian. Would that be right? Yeah. Mm-hmm. So, your ancestors would have come from, Eastern Europe. For the winter, the winters get pretty cold, I'd imagine.
Yes, very cold, -35.
Yeah, there you go. So, would your ancestors have been eating bananas in winter? Absolutely not.
Ever.
As an example, right? So when we think about what would our great-great-great-great-great-great-grandparents have been eating, if we try to follow a similar diet to them, we'd probably be pretty much spot on. Okay, so someone like me, I'm from the UK, I'm not going to eat a very high plant-based diet because my ancestors would have, predominantly lived off of animal-based foods. Okay, but if you're from Ecuador, your ancestors would have eaten a predominantly plant-based diet. Okay, so food quality is important, and also eating similar to how your ancestors would have eaten is really important. The other thing to be aware of, there are foods that people can become sensitive to, and it will differ from person to person. And again, these foods can cause inflammation in the body. So I'll give you a quick example. About 5 years ago, I just had a little change up in my breakfasts, and I started eating porridge. And a few weeks after that, I started getting pain in my left knee. And I thought, that's strange. But I didn't put two and two together at the time. This pain went on for a little while. It wasn't debilitating. But what was happening was, if I was playing tennis at weekends and my knee would get really sore afterwards, it would be sore for 5 days. And then by the next weekend, it was okay again, but then I'd play tennis and it'd get really sore. Anyway, I was away teaching a course with one of my colleagues who's an osteopath. And I said to him, you couldn't just run some knee tests on me, could you? Because I've got knee pain, but I'm not exactly sure. I think it might be a meniscal tear or something like that. So he ran some tests and he said, no, it's definitely not a meniscal tear. He said, you've got osteoarthritis. And I was like, wow, that's interesting. And I gave it some thought. And I thought, let me just stop eating the oats and let me just see what happens. Well, 3 weeks later, my knee was completely fine, right? So there was definitely something in those porridge oats, and they were gluten-free porridge oats. There was definitely something in there that was causing inflammation in my knee. Okay, so sometimes it can be as simple as that. So we've done positive thoughts, we've done hydration, we've done nutrition. The next thing is movement. Now, what we do know is when people are in pain, one of the things that reduces pain is movement. Now, most of our joints in our body are what are known as synovial joints. And what that means is there's synovium in the joint, and the synovium releases synovial fluid to lubricate our joints. Okay. Now, when does it release that fluid? When we move. So if you're in pain, one of the worst things you can do is be sedentary. Now, I do understand that sometimes movement can cause pain. So that's a double-edged sword. But what I would recommend to anyone in pain is to try and move as much as they possibly can and move in a way that doesn't cause their pain. One of the ways that can be really useful is to get into water, whether that's natural water or into a swimming pool. And, you can swim, you can walk, you can jog. Sometimes even people with, serious knee injuries can get into a swimming pool and jog because the buoyancy of the water is taking all the load off of the joints. The other thing when it comes to movement, again, that I've mentioned before, just want to re-emphasize, it's to try and optimize your posture. Now, again, it might be, you might need to see a professional to help you with that because you might not know which muscles, for instance, in your body are tight and which ones are weak, because you need to stretch your tight muscles and you need to strengthen your weak muscles. So we've got thoughts, we've got breath, we've got hydration, we've got nutrition, we've got movement. Now, the final factor that everyone can do is to do with your sleep. Sleep and your circadian rhythm. So we live in a circadian rhythm, 24 hours, night and day. So the body heals itself when we're asleep. If we don't get adequate sleep, the body doesn't repair adequately. So when you're in pain, if you've got tissues that are damaged, then you're not going to recover properly. So the recommendation is for all people is to try and get to sleep as soon as you can after dusk and to sleep until sunrise. Now, I understand people have jobs, 9 to 5s, etc. Some people work nights, whatever, but try and stick as close to that as you possibly can. And I can guarantee you it will make a huge difference. Now, another general rule that we often say is if you can go to bed by 10 p.m. and get at least 8 hours sleep, that will be really, really good guideline to follow. The later you go to bed after 10 o'clock, the more you're really eating into your ability to physically recover. The other thing with that, in terms of your circadian rhythm, not only to be asleep at night, ideally you want to be asleep in a dark environment. Now, when you're in a dark environment, it will stimulate your growth hormones. So, melatonin gets released, and that releases your other growth and repair hormones like human growth hormone, testosterone, estrogen, etc. But the other important aspect of your circadian rhythm is to try and get into the sun during the day. And again, I know it's difficult for some people, and if they're working indoors, because again, even windows, it doesn't really do the job. You need to get outside. But even if you could do 30 minutes a day during the day, it really helps to set the hormonal system. And the hormonal system is really important for recovery. So those 6 main things that everyone can do: positive thoughts, breathing, hydration, diet, movement, sleep.
Thank you. That was really, really fascinating what you said. And I just want to add to what you said about overcoming chronic pain. Maybe, for example, for back pain, I think one important aspect is as well the softness or the hardness of your bed, right? And also, for example, I used to have an ex-boyfriend who was biking a lot, and he had this bike that had a really, not comfortable kind of, chair. Is it called chair for the bike?
Saddle, yeah.
Saddle, right? And so I think a lot of there's certain things in your life that are actually causing you pain that are part of like your daily life, and you don't realize, for example, that your bed could be the cause of you having back pain. And I think a lot of entrepreneurs tend to have back pain from sitting on the chair too long. And I'm sure you have a PhD all around what kind of chair should be used and this kind of thing. And we don't have so much time to talk about it, but I did think it was very, very useful what you said. Was there anything else that you wanted to add to For example, are there any specific like tools that you recommend for people that tend to have chronic pain? Like, are there any like, I don't know, red light therapy tools or any other therapies that entrepreneurs that have recurring chronic pain can add to what you said?
Yeah, I mean, it's interesting the point you made again, and this comes in movement. So, I'm standing here talking to you. I have a standing desk, right? It goes up and down. So some of the day I'll sit in an ergonomic chair, but I try and spend as much time standing as possible because that's, again, much, much better for your overall posture. And again, that's something that entrepreneurs can potentially do. Just try not to sit too much. And when it comes to improving your posture, what you need to understand is, yeah, you can do exercises, stretches in the gym or at home, wherever. That's great. But just remember, if you're doing those for 3, 4, 5 hours a week, but you've got poor posture for 40 hours a week when you're at work, which one is going to win? So being aware of your posture, just simple things, standing up straight, shoulders back, chin tucked in a little bit. For most people, that's going to be beneficial. In addition to that, yes, red light therapy can be really good. Cold plunging can be really good. Saunas, amazing. It's particularly infrared saunas can be really good as well. But yeah, they would be the main ones I would recommend.
Thank you. Tell us where entrepreneurs can connect with you.
So I actually have a free guide that people can download, and that is at bit.ly/chronic pain valuable tips, or they can just go to my website, which is bodycheck, that's bodychek.co.uk. And if people want to find me on social media, they can find me via the website.
Thank you. Follow me for more interviews with world's most innovative health changemakers to live your healthiest life ever.